So we've been talking about medications, and medications have a lot of great effects. You know, they can reduce your risk for stroke, for heart attack. They can treat diabetes. They can treat infections. They can do a lot of great things. But many of them have side effects as well, too. And sometimes side effects of medications appear differently in people with intellectual and developmental disabilities. And they might actually cause behaviors. They could be a cause of adverse behaviors. One of the things we need to be careful of is when we see an adverse behavior in someone who doesn't communicate using words, it might not be simply because they have an intellectual disability. In fact, most of the time I would say it's not. It could be from some other cause. And one of the things to consider, there's a long list, but one of the things to consider are medication side effects. So let's say a medication makes you feel very nauseated. You're not going to feel very good. You may feel a little grouchy or grumpy. And if someone's trying to give you food, you might become agitated. You might even strike out at them. So that could be something to think about. You know, what if a medication causes some sort of adverse movement? We think about this in some of the antipsychotics, that a person may be shaky or jumpy or jittery, or they might develop some repetitive type movement. Again, that might not be, and I'm saying might not, it's most likely not going to be just because they have a disability. It could certainly be from the medication. So there are lots of potential side effects. Let's say a person is having an allergy to a medication, but they don't necessarily have a rash, but they may become agitated, irritated. They may be scratching. They may be hitting at things because they're uncomfortable. They're not feeling good or something's not right. So anytime a medication is started, you need to pay particular attention to any change in behavior that might happen in the first 2 to 3 weeks after starting a medication or after increasing a dose of a medication. Make sure you're aware of changes in behaviors. Make sure they're reported to the health professionals that you work with so that they can evaluate and see if this might actually be the cause and either change the medicine, stop the medicine that can improve the person's quality of life.